students, welcome to another online class. Today we shall be looking at non-communicable diseases. In this topic, we shall be defining non-communicable diseases. We'll look at examples and nature of some of the listed examples. Firstly, what are non-communicable diseases? These are diseases that develop from inside the body and cannot be transferred or transmitted from one person to another. That means we cannot contact them either through the air, nose, mouth, or whatever. Some examples are cancer, sickle cell, rickets, peptic ulcer, diabetes, stroke, high blood pressure, which is also known as hypertension. We have dental caries known as cavities or tooth decay. We also have otitis media and boil. Firstly, let's look at sickle cell disease.
Hey there! I'm here to tell you about sickle cell disease, an illness that affects over 100,000 people right here in the United States, and millions more around the world. The first thing you need to know is that you can't catch sickle cell. It's caused by a genetic change that is passed down from your parents. If a mom and dad both have that change gene, then the child has a chance of being born with sickle cell disease. Now, let's talk about what sickle cell can do to your body. These are red blood cells. More specifically, these are healthy red blood cells. These little guys are what carry oxygen all around your body to places that need it, like your heart, your brain, and your lungs. See how round these red blood cells are? That shape and the fact that they're super flexible allows them to move through the body without any holdups. That's good. People who live with sickle cell disease do have healthy round red blood cells, but they also have cells that look like this, a little different and not as round. See that? It kind of looks like a banana, or what they call sickle shape. Sickled red blood cells are very fragile. This causes them to break down more easily than healthy red blood cells. Picture a jelly donut exploding. Everything is released from the red blood cell, and the entire thing breaks apart. This is called hemolysis. When those sickled red blood cells break down, one of the things that is released is a substance called bilirubin. Too much bilirubin can cause the eyes and skin to turn yellow, which is called jaundice. Also, because the sickled cells break down, there are less and less red blood cells in the body to carry oxygen. When there are too few red blood cells carrying oxygen, it can lead to something called anemia, which can make people weak and tired. Also, those sickled cells are stiff and sticky and don't move freely. They can pile up and block blood flow inside your blood vessels. It's like a traffic jam and can keep the healthy red blood cells carrying oxygen from getting where they need to go. When those banana-shaped red blood cells get stuck in the tiny blood vessels, it can also cause a lot of pain. In the joints and bones, in the chest and stomach, it's called a pain crisis, or an even bigger word, vaso-occlusion. VOCs for short. A pain crisis can last a few hours. It can last days. And it can be so bad that a person with sickle cell may even need to go to the hospital. All of this, the red blood cells bursting, the low number of healthy cells, and the traffic jams in the blood vessels means that less oxygen is delivered to the body, and that can do a lot of damage to important parts of the body, like the bones, organs, and tissues. They all need oxygen to do their jobs, and keep you feeling your best.
Treatment. Sickle cell anemia has no widely available cure. However, treatments can help relieve symptoms and treat complications. The goals of treating sickle cell anemia are to relieve pain, prevent infections, eye damage and strokes, and control complications. Bone marrow transplants may offer a cure in a small number of sickle cell anemia cases. Obesity. Obesity is a medical condition involving an abnormal or excessive fat accumulation that presents a negative effect on health. Obesity is defined as having a body mass index, or BMI, of 30 kilograms per square meter or more. The range 25 to 30 kilograms per square meter is defined as overweight. A body mass index is a measurement obtained by dividing a person's weight by the square of the person's height. Obesity is further evaluated in terms of fat distribution around the waist, or waist circumference. Men with a waist measurement of 94 centimeters or more, and women with a waist measurement of 80 centimeters or more, are more likely to develop obesity-related health problems. Obesity is a chronic medical condition that increases your risk of diseases and health problems, particularly certain types of cancer, cardiovascular diseases, type 2 diabetes, osteoarthritis, infertility, irregular periods, non-alcoholic fatty liver, and obstructive sleep apnea. Obesity can also affect your quality of life and lead to psychological problems such as depression, low self-esteem, shame, guilt, and social isolation. Causes: obesity is caused by eating more calories than you burn through exercise and normal daily activities. As a result, your body stores these excess calories as fat. Common specific causes of obesity include inactivity, having a sedentary lifestyle, unhealthy eating, such as eating a poor diet of foods high in calories, lack of sleep. This can lead to hormonal changes that can increase your appetite. You may also crave foods high in calories, which can contribute to weight gain. Genetics can play a role in how your body converts food into energy and how your body burns calories during exercise. Pregnancy. Sometimes weight gained during pregnancy may be hard to lose, eventually leading to obesity. Aging, which can lead to a decrease in the amount of muscle in your body. This decreased muscle mass leads to a slower metabolic rate, making it easier to gain weight. Certain medications may cause weight gain or changes in the body composition, such as insulin, antidepressants, steroids, and some form of hormonal contraception. Symptoms. The symptom of obesity is having a BMI of 30 or more. Obesity can be characterized as BMI of 30 to 34.9, obese class 1, BMI of 35 to 39.9, obese class 2, BMI of 40 and higher, obese class 3. Treatment. The aim of treatment is to help you lose weight and maintain a healthy weight. Weight loss programs are available. They require changes in your eating habits and an increased physical activity. Treatment options suitable for you depends on your level of obesity, overall health, and your preference. Other treatment tools include behavior changes, weight loss surgery, dietary changes, exercise, and
Asthma is a chronic condition that affects the airways in the lungs. The airways are tubes that carry air down deep into the lung. When you have asthma, the walls of your airways become inflamed. This makes the airways sensitive. The airways react strongly to certain irritating things that you breathe in. This reaction makes the airway muscles tighten, and much less air flows to the lungs, making it harder to breathe. Cells in the airways may also make more mucus than normal. People with asthma may experience wheezing, coughing, shortness of breath, and chest tightness. They may also wake up at night coughing and short of breath. When the symptoms get worse, that's called an asthma attack. Asthma affects people of all ages, but it most often starts in childhood. Asthma is a long-term disease that can't be cured, but it can be controlled.
To help treat an asthma attack, we first need a rescue inhaler. A rescue inhaler works in minutes and only lasts a few hours. And what the medication in this rescue inhaler does, and the only thing it does, is work on these muscle bands. And the way it works is by loosening the muscle bands. So let's see what that would look like. So now the muscle bands are loosening, and the airway is once again more open. But there is still swelling, because the inflammation doesn't go away with the rescue inhaler. So to really open up this airway, to reduce the inflammation, you need a controller inhaler. A controller works over days, but lasts much longer. And that's important. What the medication in a controller does is decrease inflammation in the airway. And it works in this area of the airway. Over days of using a controller on a daily basis, the inflammation will decrease, the swelling will go down, and the airway will become more open over time. And finally, with asthma back under control, the airway is able to have air come in and out much easier. So now you have an airway that is open and similar to a normal airway.